Well, good afternoon, everybody. We thank you again for joining us on this webinar series brought to you by the Houston Area Safety Council and the University of Texas School of Public Health. Today's topic is a really interesting and pertinent topic, and that is going to be on mental health and employee resilience, specifically on returning these employees back to work during this pandemic, and also how do you handle these employees once they are back to work? What do you need to look out for? What are the pitfalls? What are some of your legal obligations that you may have to deal with when returning these employees safely back to work, and hopefully maintaining their safety and their health while they are at work? I think that's everybody's goal. So again, we welcome you to this. I think we're on either 5 or 6 now of our webinar series, and they have been greatly well attended, and we appreciate all of your attendance today. Throughout this webinar, we're going to give a short presentation up front on some current trends of this pandemic, but the majority of the webinar is geared towards question and answers by you, the attendees. So everybody is on mute, and you can't verbally ask a question. So what we ask you to do is type in that question to the question box that you should see on your app that you're using. Feel free to ask as many questions as you can, because that's what keeps this lively and going. Otherwise, we have to make up our own questions, and we much rather you ask the questions that are pertinent to what you're having to deal with during this time. Again, brought to you today by the Houston Area Safety Council and the University of Texas School of Public Health. 2 mission statements by these 2 entities: building safe workplaces and changing the culture of health. And what is more honorable than that, right? When we're trying to get these employees back to work, getting them safely back into the job site, but also maintaining their health and their safety. Without that, well, we're not going to have any employees, right, that are safe and able to come to work. So we thank these 2 entities for producing and bringing this webinar series to us. We want to thank the Houston Area Safety Council Platinum sponsors. These are our top sponsors that help contribute to endeavors like this. Without their support, we wouldn't be able to roll out some of these initiatives. So we thank all of our Platinum sponsors for their continued support. So a brief agenda today. If you've been on these before with us, you kind of know the flow and what happens. If you're new to this webinar series, we do a very short presentation up front by our PhDs at the University of Texas. They're going to give you the current trends of what's going on with this COVID-19 virus. We're also going to talk about ways that you can make sure that you are reducing the risk of this virus in your workplace, because we know that's extremely important right now. And then at the end, we're going to talk about the resources and the references that you can turn to on your own that are out there that you can reference and get more educational data to protect your workplace. And then, of course, we're going to open up to that Q&A session at the end. So here is our list of routine panelists, I should say, and our guest panelists. And I think we've got a powerhouse of guest panelists on here today. We're very fortunate to have C.B. Burns, who is our first attorney that we've had on this webinar series. So I anticipate a lot of questions related to the legal aspects of, how do I make sure my employees are able to return to work safely? What are some of my legal pitfalls? And then we have a whole group of PhDs and scientists that are going to help us navigate the mental health questions that we all have related to this virus. So Dr. Delclos is our first speaker today, and he is going to introduce, I believe, everybody up front, or maybe along the way as ever he deems fit. So I'm going to turn it over now to George Delclos to give us a current update on this virus.
Okay, thank you, Tommy. Before I do, though, I would like to introduce our speakers. We're very lucky to have 4 guest panelists in addition to the usual crowd of 5 that we have here. Our first guest panelist is Clara Burns, or CB Burns as she goes by. CB is a partner in the Kemp Smith law firm in their labor and employment law department, and she's a member of the firm's management committee as well. She's board certified in labor and employment law by the Texas Board of Legal Specializations and is also licensed in New Mexico. In addition, she's the editor of the Family and Medical Leave Act chapter of the Texas Association of Business Texas Employment Law Handbook and author of the Texas Human Resources Manual, which is published by the American Chamber of Commerce Resources. So we welcome her here. Monica Guidry is, hang on, let me open it up here. She's executive director at our university, UT Health here in Houston, the Office of Employee Assistance Programs. And as executive director of our EAP, she's responsible for our internal EAP work life and wellness program and for the operations of EAP services for external organizations, including Baylor College of Medicine, Rice University, Texas State University, and several UT sister organizations across the state. She and I have worked together for many, many years, and it is really a pleasure to work with her and a very unique asset that we have access to. Dr. Francisco Perez is a clinical occupational psychologist who's also an adjunct professor of occupational health psychology in our center, the Southwest Center for Occupational Environmental Health at the University of Texas School of Public Health in Houston. And he and I have been working and collaborating together for over 30 years. When he was actively practicing clinical psychology, he specialized in occupational psychology, and which is a rare specialization area within psychology. And more recently, he has been collaborating with the university on delivering courses to our graduate students in occupational health psychology. And finally, we have Dr. David Jimeno, who is the director of the Southwest Center for Occupational Environmental Health. He's also a professor at UT Health, School of Public Health, but at our San Antonio campus. Originally trained as a clinical psychologist, David is best known now for social and occupational epidemiology. He is a whiz with epidemiological study designs and statistical analysis, but really brings what he brings to this group of panelists is his expertise in what we call the social determinants of health, which are very relevant to the topic that we are addressing today. So wanted to welcome all of them. And let's see, Tommy, I'm going to go to my first slide, please. So every week I try to update folks on what the situation in Texas is using the most recent data. These data are from yesterday, and some of the graphs are developed by colleagues, specifically Dr. Jose Miguel Yamal in our Department of Biostatistics. Many of you have probably listened to the governor or know that he spoke yesterday, giving an update on where we were with the reopening of Texas. And he did say that we were moving forward with that reopening, but at the same time acknowledged that there have been some increases in rates and sort of put those into perspective. So I'm going to go over some of those figures real quick right now. This is a graph of the daily number of new COVID positive cases as of yesterday in the state of Texas. And you'll see that this graph over here on the left, it begins in March. These were our daily number of cases, and they began increasing as the pandemic hit Texas. Around the third week of March, the shelter-in-place recommendation was made across the state, and you'll see that cases continued to rise. But at about 2 weeks, which is the average incubation, not the average, the maximum incubation period for COVID, things seemed like they were leveling off. And then on May 1st, we began the reopening process, a very careful reopening. These were the days of, for example, only opening restaurants to 25% capacity, et cetera. And you know, it looked like it was the curves were beginning to flatten. And then came phase 2 of the reopening, which also coincided with the Memorial Day weekend. And since then, the rates have been going up. We implemented phase 3 in early June, and that doesn't seem to have affected the slope yet, but we're just nearing the 2-week mark now of phase 3 reopening. So that's in the background. Next slide for Texas. One of the things that the governor's office keeps track on is what we call the positivity rate. This is the total number of tests that are positive over the total number of tests that have been conducted. And so Y'all have probably been hearing that we have access to more and more testing. Citizens have access to more and more testing across the state. That's true. And so one of the things we try to keep in mind is how many of those tests are positive, and we express that as a percent. And in general, as long as numbers are below about 5 to 6%, we're doing okay. But once they start to rise, we get into areas of increasing concern. Right now, we are at above 5%. We're somewhere in the 6 to 7% range. So that's something that we're going to need to keep an eye on. And certainly if we go into, actually, I don't know why this is blue, it should be orange. The orange rate, which is above 10%, then we should become more concerned. Then finally, if it gets above 15%, then that really is serious. This is one of the indicators that the governor's office follows. And so, you know, when he issued his reopening order, he said that the reopening phases were going to be guided by science and by the data. So right now we're at levels that are manageable, but we are creeping up in some of the parameters. So we got to keep an eye on that, because it might be necessary at some point to hit the pause button on the reopening process, or if things really get bad, maybe even take a step backward. Now, some states around the country have already hit the pause button given their particular circumstances, but this is a situation in Texas right now. Next slide, please. This is a new slide I'm including today because one of the other parameters that the governor's office keeps an eye on is the ability of hospitals to manage this increasing number of cases. And so what you see on the top line is these are all Texas beds, right? So we have a lot of available hospital beds, but a hospital bed is not a hospital bed is not a hospital bed. One of the things that, one of the indicators that we most closely keep an eye on is the number of ICU beds that are available to meet this increased demand. And you'll see that's the blue line down here. And you'll see that obviously we have much fewer ICU beds than we do total beds, but around 2,000 something is the norm. And we've been going down. We were initially going down to their reopening, meaning more ICU beds were available, but now this line is starting to creep up, indicating that ICU beds may be starting to fall behind. We still have a surge capacity, as we'll see in a minute, but there are fewer and fewer ICU beds, so we need something we need to keep an eye on. Ventilators, which were a big topic in the news, we're doing okay on. We have many ventilators across the state. Now, these are just state numbers. That doesn't mean that there aren't marked differences in the availability of beds, ICU beds, and ventilators in specific localities around Texas. You might have a good picture looking across the state, but there might be certain municipalities or counties where they are struggling. Next slide. And that simply is illustrated here in this map, which I show every week. This is from the Johns Hopkins website. And what it illustrates, simply to show you that in the state of Texas, all these different shades of and colors indicate different rates of disease in different parts of the state. So even though we were just looking at state averages, we have to do that, but remember at the same time that there's a lot of variability across the state. So we have high incidence areas, even in small counties. So for example, around the Amarillo area, a lot of that was due to cases in a meat packing plant, and others have high numbers because they have high numbers, for example, of prisoners that are infected, or maybe of nursing homes. So we need to think in terms of the state, but we also need to, very importantly, take into account what our own situation is in our own location, because that is useful in deciding what to do for your particular circumstance. Next slide. And as an example, here is the greater Houston area. This is not just Houston, but all the surrounding counties, including Galveston. You'll see that the shape of this curve is similar to the state, but with some important differences. We also started off low and then sheltered in place in the greater Houston area at about the third week of March. And cases at 2 weeks, which is when we would expect to see the effect of this shelter in place, seemed to level off and even start decreasing. And then the reopening began. And the first phase of the reopening seems like it didn't make much of a dent, which is okay. But as soon as we hit the second phase of the reopening thing, which again is the one that coincided with Memorial Day weekend, things began to increase, and they have continued to increase ever since. And now we're in phase 3 and nearing the 2-week mark since the phase 3 began, and the rates are going up. Next slide. So one of the things that we do in the Texas Medical Center, because these are a lot of numbers, what we've developed here in Houston is a set of early warning signals that are used to help us discuss and decide whether mitigation actions, in addition to what we're doing, are needed. And so without belaboring it, you know, up until about 2 days ago, one of the things that we monitor is this daily 7-day trend of number of cases in the Houston metropolitan area. And up until 2 days ago, this had been going up for a continued, for at least 12 days in a row. In the last couple of days in the Houston area, they've gone down a little bit. And so now we have 0 days of positive average growth, but this is a day-by-day indicator that we look, and you'll see that it's green. Green is good. However, we have some areas of yellow and now red, and it mainly relates to the capacity of hospitals to have enough ICU beds to handle influxes of COVID patients. And so right now in the Texas Medical Center area, about 76% of the ICU beds are in use. The majority of them are not occupied by COVID patients, but we need to reserve that surge capacity in case there is a big uptick in COVID cases requiring ICU care. And so the current level that we're at 76%, we also use that number to project how many days worth of ICU beds do we have if the increase continues along the same path. And right now, that is our first red area. So right now, given the rate of increase in number of cases requiring hospitalization and ICU care, coupled with the decrease in availability of ICU beds, even though we still have some, we think that if we continue at the same rate, ICU capacity might be exceeded in about 2 weeks. So that's definitely something to keep an eye on. The good news is for our healthcare workers, our frontline doctors and nurses who are taking care of these patients, we now have plenty of personal protective equipment for them to be able to take care of their patients while protecting themselves. Next slide. So now I wanted to move into just in this last part. I wanted to make all of you aware of a free app that is available to anyone, any citizen, any employer, any worker, that was originally developed by Harvard University, and our colleagues here at the University of Texas School of Public Health are also participating in this project. The idea of this app is to monitor symptoms that each person might have or might keep track of every day on themselves. And then these data are later analyzed totally confidentially. The data is what we call de-identified. That means it's not linked to any individual person or their name or anything like that, but it can be analyzed by, for example, zip codes or counties. And if we see an uptick of people who are reporting symptoms, that could be an early indicator that there's a problem developing in that county or in that zip code. This does not have to do with testing. It's simply symptoms of COVID. And we are going to make these slides available to you after the presentation. If anybody is interested in downloading the app, you have the links right there. Next slide. This can also be useful not only to individual citizens, because, for example, families can use this app daily to record their symptoms for all family members, even when they are well, but it also could be useful to businesses in the areas, because they can use this information to basically adapt whatever mitigation strategies they are using now to their local circumstances. So, for example, if they've implemented a series of measures in their offices and following CDC guidelines, but all of a sudden there's a significant increase in cases in their locality or in their zip code area, that might stir them to add additional measures to help prevent the spread within their workplace. So for more information, you can contact our colleagues, Dr. Srila Sharma or Dr. Bijal Bala. These are their emails, and as I said, these slides will be made available to you after the presentation. Thanks, and I'll pass it on now to Janelle, I believe.
Thanks, George.
Hi, everybody. My name is Janelle Rios, and I'm a faculty associate at the UT School of Public Health. And today I'm going to share with everybody very briefly a well-known and often used public health tool that serves as the foundation for controlling hazards in the workplace. Now, I've adapted this tool a little bit for use anywhere. And this tool is called the hierarchy of controls. And the hierarchy refers to the effectiveness of each of these control types. So at the very top, this is typically and traditionally graphically seen as an inverted pyramid. And at the top of this inverted pyramid are the most effective controls. And I do want to make everyone aware that a lot of these controls are not visible to people, that they're not the ones that are really cool and people are seeing, like masks out in public. So elimination is a very effective method at controlling the COVID hazard. And I encourage everybody to practice primary prevention techniques to keep the virus from entering your home or workplace. And how do you do that? These are things that we can control. We're empowered to do this. We can limit visiting locations where non-household members gather. So when you go to the grocery store, you go to the hardware store, don't do that very often. Get what you need and leave and come back home. Wash your hands frequently. That's another way of keeping this particular hazard away from your home. And to the very right of the pyramid, I have a little graphic that shows a person who's telecommuting and actually not going into the office, but working from home. Next slide, please. Next, we have engineering controls. So, and I think that'll pop up. Here we go. And some of these engineering controls you can't see either. For example, HVAC technologies, like increasing the number of air exchanges. And my colleague, Bob, who just put his photo up there, he'll explain a little bit more about air exchanges versus ventilation versus air circulation. There's also these inline UV technologies because the virus is actually pretty susceptible to UV light. And these can go in line inside of the air conditioning system. Also, cleaning and disinfecting work surfaces, your home, frequently touched areas. I know with my alarm system, I come home, I have to press the buttons on my alarm system. In my hands, I still feel like they're contaminated as soon as I walk in the door. So my alarm pad is something that I disinfect pretty frequently. And here I'd like to draw your attention to the EPA registered disinfectants list N. N as in neighbor. So on this slide, I have a hyperlink to these EPA registered disinfectants, and it's a very nice tool because you can search by a variety of things, but one of those things is contact time. So if you have a very minimal amount of time that you can spend on disinfecting, you can spray something, you can find this the perfect disinfectant for you. 2 minutes or 1 minute contact time, and then it works, and then you can wipe it off. Next slide, please. Administrative controls. This typically would refer to how work is performed and changing behaviors. So here, one of the things that we can control ourselves is training and learning how to screen yourself for COVID symptoms. Taking training on resilience, because there is training, and I would point to the World Cares Organization out of New York, and they came up after the 9/11 tragedies, and they have wonderful training on resilience. Practice social distancing when you're out and about in the world, and here I have a graphic that kind of tries to show that social distancing. Next slide, please. One of the least effective methods in this hierarchy of controls is personal protective equipment. And here I have an example of an N95 respirator. When all else fails and we can't do all of these other controls, or we're very limited with the other controls, we protect the worker or the person. And we do that with equipment that is specifically designed to protect the wearer. So if you have a job where you need to wear personal protective equipment, understand how to wear it, how to use it, how to disinfect it if you're using a reusable respirator. This one happens to be disposable. Next slide, please. But what we normally see out in the world, and this gets a lot of media attention, is community protective equipment. And these are things like facial coverings, cloth ones that are reusable, they're washable, or disposable masks. Now these things are designed to protect others from you. So less protecting the wearer, but to protect others from you. So it is polite to wear these kinds of masks when you're out in public. So learn how to use them, reuse them, care for them, how to wash them and dry them. And these are things that we can do to protect ourselves. And I know this slide is really busy. That's why I wanted to present it in pieces, but there's a lot of information on this slide and I hope it's very useful. Thank you very much.
Thanks, Janelle. And there was another question about, will these slides be made available? Absolutely, they will be. We will email this out to all of our attendees, as well as there will be a full recording of this live webinar, and that will be posted on the Houston Area Safety Council's website, but we'll also make sure everybody has access to that as well. So thank you again, Janelle. All right, Bob, I think this is you. Is it? No, it's Christy.
Me. Hi, I'm Christy. I'm the Dean of the El Paso campus of UT Health Houston School of Public Health. And this really just springboards off of what Dr. Rios just explained. When we think about the risks associated with exposure to the novel coronavirus and then the stress that can come with that, we do know that there's a myriad of things, as Dr. Rios explained, that we can do to empower ourselves to mitigate those risks. And so the list here on this slide is nothing new. These strategies, we've heard them over and over again since the start of the pandemic. I think what is new, as we're so many weeks and months now into the pandemic, is that there are data that supports these safeguards. There's data that shows they are effective at minimizing exposure and thereby mitigating health risks. And just to emphasize one of Dr. Rios's last points, I mean, definitely the wearing of the face coverings, that would be more of a community effort, because the wear of the face covering is not protected. It's really protecting those around you. But it's hand washing, disinfecting services, and definitely maintaining social distancing practices. Decisions made at the community level and at the individual level can be protective of public health. So there are ways as individuals that we can make decisions to combat the pandemic, and I think maybe release some of the stress levels. We do have some control thereby how to minimize exposure. Thank you.
All right, Bob, take it away.
Okay, I'm up. So hey, I'm Safety Bob. So I got 4 things I'd like to share, but I really welcome all of the comments and questions that will flow in. But with regard to the topic of this webinar, I really want to underscore this first point, that unfortunately in the public media, they have dropped the term novel from referring to the coronavirus. And the reason I think that's so important is that there are some things, the term novel means new, and there are some things we know about the virus, but there's some things that are not known. And so with regard to mental health, I think it's really important, in my opinion, and I welcome your questions and comments on this, to prepare people to say, here's what we know, and here's the things we can do that we know are effective, but understand there might be some changes coming, right? So that I think, and I defer to my colleague, Monica Gidry and others on this, but I think that's kind of an important point, to prepare people for there could be some changes. My public health background tells people that you might want to stay tuned to what's called the R0 value. That's the R sub 0. That's how many additional cases would one expect when a confirmed case is identified. I believe the current number, it changes, but I believe it's 2.2. To give you a feel for that, I believe influenza, if maybe George, I don't know if you can chime in on this, but like seasonal flu is maybe 1.2 or so.
1.5, 1.6.
Yeah, okay. Yeah, whereas on the other end of the spectrum, something like measles is like 15, 16. Is that correct? Or anyhow, okay. So
Yes.
to give you a feel for that. So that number one, just understand it's novel, it's new, there's still things to be learned about this virus. Number two, screening, we get a lot of questions about temperature scanning and these sorts of things, but really screening begins at home. And the reason I put it in quotes is that screening is that notion of getting people to accept the responsibility of, if I'm not feeling well, don't come to work or don't come to my facility, and then to go through the process. And I suspect there'll be many questions about this. I think we've already covered the issue of masking. I think Janelle and Christy have covered this notion of masking. The one purpose of masking is to be a barrier to transmission, because an important point here, I'm not sure we've covered it on this particular thing, is that you could be a transmitter of disease while you are not exhibiting symptoms. So the idea there is if people mask while in public, then you won't inadvertently affect others. And then on the other end is protection for the wearer, such as N95s, these masks that have been described. The last point, it has to do with cleaning and disinfection. And there's been a variety of studies that have come out looking at the viability of this virus on different surfaces. And this, I throw out a number of 72 hours. So my commentary would be, you want to darn sure make that whatever cleaning that is going on or regular disinfection, make sure that these are EPA registered disinfectants, as Janelle Rios described. But most importantly, write this one down and underline it. Make sure that they adhere to the contact time, because these products can be virtually ineffective if they're just going in, spraying a door handle, and then just wiping it right off. That contact time is really, really important. So I'll stop there, and I welcome any questions. There's a lot more stuff we could talk about, but let's get to the meat of the issue here.
Absolutely, thank you, Bob. And again, feel free to type in your questions on the question box you should see on your screen there. We've got a couple that have come in, and I'm going to wait until we finish rolling through some of these initial slides, and then we'll start going into our question and answers. All right, some references.
Oh, yeah. Oh, I think that might have been my slides. I'm not sure, but there are some references. Then let Dave handle it.
Yeah, those are Bob's slides.
All right, go ahead, Dave.
Sure. This is Dave Dufresne. I'm over here in San Antonio at our campus here in San Antonio, and my job was just to put together some simple resources for everyone regarding today's topic. I think we would all agree that we are living in unprecedented times and stressful times, and that means we're working in unprecedented environments, unprecedented times, with a multitude of new dynamics, workplace stressors, and there's a lot of uncertainty that's out there. You or your workers may be experiencing fatigue, stress, not only with what's going on in the office, but also with dynamics at home. For those of you on the call that have kids, we've been having to put up with our kids at home because schools have been closed. Now we have to put up with them for the summer months, and we don't even know what's going to be going on in the fall. And so we also have our extended family. We have the unknowns with elderly parents and everything. And so all of these dynamics together can lead to stress, maybe even some anxiety. And so what I've done here, I looked all over the internet, and there's many different resources that are out there to address stress, fatigue, anxiety related to this pandemic situation. And so what I put on this slide was what the Centers for Disease Control and Prevention, the CDC, has put together. And to my amazement, they have a number of different resources and documents to address these very issues. And so I just wanted to bring to your attention these documents, these resources that you as an employer or you personally might benefit from regarding living in close quarters. You might have multiple family members under the same roof, how to manage fatigue in the workplace, stress, how to deal with job stress regarding as well as resilience, stress and coping, reducing stigma. A lot, I was trying to appreciate, if a worker might test positive, there might be stigma associated with that situation. How to keep your children healthy during the environment. And then the last one there is how to stay active. And we all know that staying active and exercise is very important, and not only to keep ourselves healthy, but to control anxieties and stress. And so those are just a few of the resources that we put on this slide, and those are going to be made available for your later viewing and access.
All right, perfect. Thank you very much. Well, that brings us to the end of our formal presentation. So what I'm going to do is ask that all of our guest panelists activate their webcam so that everybody can see us. And going to start into our Q&A session. So again, I see the questions are starting to come in, so that's wonderful. So let me I'll throw out an initial question, maybe as an icebreaker. I'm sure that history can tell us a lot when it comes to employees and the general public's mental health during crises, right? We've been through a Great Depression. We went through a financial crisis in 2008. The world has seen SARS and MERS and tsunamis and earthquakes and hurricanes. What does history tell us about the mental state of people during these crises when they don't have a job, they have no income, they can't leave their house, or maybe their house was destroyed? What do we know? What are we concerned about trend-wise when it comes to people's mental health during times like this? And I'll throw that out to whoever wants to jump in and unmute themselves and chat.
So hi, this is Monica. So you threw out a lot of question in that, a lot of items in that question, and what we know is that there are some people who would tick off every stressor that you just identified, and yet show unbelievable resilience when people are saying, "How did you ever survive?" And then there are people who may have great opportunities available to them who aren't quite so resilient. What we know is that it's not one dimension, that we have to look at all of the dimensions of well-being for an individual. But as an employer, I think the number one thing we have to look at is what is our own level of awareness of what we are dealing with, and how we then move forward to helping our other employees. Because if we come in with our own biases, with our own perspective, with our own lack of resilience or stress and anxiety, it's very difficult for us to hear what our own employees are going through. So you hear all the time in airlines, you put your mask on first, then you're able to kind of help the others. What's critical is that not one answer will address every employees' resilience or stress tolerance level. So awareness, I think, is the very first thing that we have to be aware of, and not just assume people will find their own resources.
Great, Monica. Thank you very much. Did anybody else have a comment, Frank?
Sure. You know, when we face a situation like the one that we're facing now, in which we have uncertainties, we have to adapt to significant changes that we don't like. What happens first is typically our mind goes usually to the darkest thoughts that we typically have. And we all have them. And I think one of the most important things that we can do to manage a situation like this is like Donna Karan, the fashion designer. Recently, I was looking for a best definition that I could find, or the best suggestion to manage chaos. And she has the best suggestion, which is finding the calm in the chaos. And that's a very difficult thing to do. And it's the chaos of your thinking process as it relates to what is happening to you. And I think one of the best ways to do that is to develop some specific behaviors that enhance your well-being. One of them is to focus on mindfulness. Mindfulness involves the process of focusing on relaxing and focus on the present and now, and get oriented towards problem solving. The second one is identify those dark thoughts that you're having and identify a way to improve them. There is a system that has developed by a psychologist by the name of Ottinger. She actually has a great book that I encourage all of you to get, which is called Rethinking Positive Thinking, that basically focuses on a system that she has developed that is called WOOP, W-O-O-P. And that system involves wish, what do you wish? Objective, what do you want to accomplish? Obstacles that are on your way to reach those objectives and goals, and then a plan. And people who effectively use this system to deal with their negative thoughts can actually see the calm in the middle of the chaos. It's a process of developing ways of rethinking your situation in a more healthy and positive way. So connecting with others is certainly important, even though it's difficult sometimes when we're at distance with each other. But connecting with a coworker, connecting with a colleague. I recently had a very fascinating experience of a high school classmate, and I graduated in 1965, that's a long time ago, who called me from the Dominican Republic, and where he lives now. And I haven't talked to him in ages. And you wouldn't believe how that brightened my day. And I think all of us can do something that is free, which is engage in acts of kindness. And in addition to, and kindness is probably one of the best ways of building resilience. And the other one is being grateful. I have embarked in the process when I walk at Herman Park or close to Herman Park. I don't dare even get into Herman Park these days. Is to thank somebody who is grateful and moves out of the way or keeps distance from me. You know, these are things that we can all do. We need to remember that the only way we can prevent catching this virus is through our own behavior. And we need to set an example. And by doing so, we enhance our well-being.
Excellent, Dr. Perez. Thank you very much for that insight. Anybody else have any initial comments? All right, so I'll jump to our first question that was typed in here, and it has to do with employment. So it may be a CB question or whoever can jump in, but if an employee says they do not feel safe at work, are they entitled to unemployment without an official layoff?
Okay, that's probably a good legal question. And it probably doesn't have a straightforward answer. But just general unsafeness, without pointing to some specific cause, is not a reason not to be able to work, and it generally will not be seen by the Texas Workforce Commission, which determines employment or unemployment eligibility as a reason. Now, there are reasons that the TWC allows, which if you can't go to work because you live with somebody who's in a high risk group and you're fearful for that reason that you might expose them, those are reasons that the TWC would allow. But if it's simply personal and that you are fearful, then that's generally something the TWC probably is not going to allow.
Excellent. Thank you very much for that legal answer. I know we've had that question come up a few times, and nobody on our panel has been an attorney, so we appreciate any insight you can give us on some of those.
And just to add, if you don't mind, you can actually go to the Texas Workforce Commission's website, and they have some guidance that they have offered on when they will or when they consider it to be good cause not to go to work as it relates to COVID and COVID concerns. And so that's one of them if you're taking care of a high risk individual and you don't want to expose. And there's some others, but that's a good way to kind of get to some quick answers for some of those types of questions.
Okay, great. Thank you for that resource. George, I think this question is directly related to this graph that you showed. And this is the daily new number of COVID cases throughout the state. And the question was, given the fact that the number of tests have increased over time, would it be fair to say that this graph, in conjunction with the number of tests, would be more of a flattened curve?
That's a great question, and that's a very relevant question, because one of the issues that was discussed in the governor's conference yesterday was that some of this increase might be due to testing. So with the limited time that we had, I wasn't able to show y'all another slide that was also done by our biostats department, in which they compare the trend in testing to the trend in increase in daily number of new COVID cases. And even though it's true that tests are going up, they're going up in terms of being more available, they're going up at a slower rate than the rate of increase that we are seeing. And so that's one indication that not all of the increase is explained simply by more tests. The other indicator is the increased rate of hospitalization. So think about it. If you're offering more tests, if it's easier to test people than it was before, then the types of cases that you would pick up are more likely to be people who don't have symptoms, because we know that you can be positive and yet have no symptoms or be asymptomatic, or people who have very mild symptoms. What you would not expect would be at the same time to see an increase in the number of very sick people, sick enough to require hospitalization, because those folks have been pretty much tested all along because they were sick enough to go seek medical attention and be hospitalized. So we are seeing an increase in daily number of new cases. If we had not seen an increase in hospitalizations, then yeah, probably a lot of that would be explained by more testing, but that's not the case. Increased testing does explain some of it, but not all of it.
Thank you very much, George, for that. Another question that came in is that this person is a psychotherapist and wanted to know what's the comfort level for a therapist to interact with a patient without a mask on, assuming they can keep 6 feet of distance. Would you recommend that? Would you not recommend that? I'll open that up for opinion.
Well, let me dive in here. So face coverings and face masks are designed to supplement social distancing. The key thing is still maintaining a distance of 6 feet or more. If you add a mask on top of that, that's simply an added layer of protection. Or if you cannot maintain 6 feet or more, then definitely you need to have your face covered. If you can keep if it's important to not wear a mask for purposes of the success of the counseling session, then things that you need to take into account. Yes, you could remove your mask, but above all, preserve, maybe even extend the distance beyond 6 feet, but also look at the conditions of your office. If you are in a very, very small office where air is not ventilating, well, where the air exchanges are poor, those are some considerations that might promote or might decrease the level of safety of you not wearing the mask. It's not just as simple as have the mask or not have the mask.
Gotcha.
Let me jump in there too, Tommy. Perhaps an engineering control might be helpful. Something like plexiglass between the therapist and the patient. That would be helpful as well. But I agree very much with George that masks are to supplement the social distancing because there are some aerosols that are generated by speech, as well as droplets, and those have different distances that they travel. So it's best to maintain at least a 6-foot distance, but more is preferable. But in that particular case, I would recommend looking at a desktop plexiglass to separate, to isolate each person from the other.
Yeah, I want to second that. Most of my colleagues who are clinical psychologists and are practicing psychotherapy have a plexiglass system between them and their patient to protect themselves and also to protect the patient, because remember, they're reliable. If something happens to the patient, you catch it, and maybe Claire or Clara can help me with that. But my malpractice insurance sent me a notification saying that we're responsible for anything that happens to the person that we're treating, and we have to keep that in mind. And I think the plexiglass is a good way of doing that. Clara, do you have any answers to my question?
Yeah, I'm not a personal injury lawyer or a medical malpractice lawyer, but I think it's always good to mitigate risks as much as you can, because in the event that you are sued, you can say you've taken, all reasonable precautions to avoid spreading the disease. So you can translate that to the workplace. It's just, I work in a law office, for example, and we've installed plexiglass at our secretarial stations because they're in more of a cubicle than an office. But by having that plexiglass, when people leave something for them or walk by them, then that plexiglass is protecting them. So it's the same theory as you want to mitigate against those risks.
Here's a question related to testing. So maybe this is a George question, but yeah, the question is on reliability and accuracy of the different types of tests that we have now. The PCR nasal swab versus the new rapid testing. Can you talk a little bit about kind of the gold standard that we have right now and the other options?
Sure. So first of all, there are different types of tests that test different aspects of a COVID infection. The test that is the most reliable to see if you have an infection now, an active infection now, is what's called the PCR test. This is the one that we see on TV, people poking a swab pretty much through your nose, way to the back of your throat. Some people feel that it's actually penetrating into their brain. It's not, but it's not comfortable. And that is the most reliable one out there, but it indicates active infection. We've also heard about antibody tests. Antibody tests are especially useful at saying if you have had the infection in the recent past. But for all of these tests, and some tests are faster than others, some of them are qualitative and some of them are quantitative. Qualitative are tests that just simply say yes, no, detected, not detected. Quantitative tests actually give you some measurements. But for every test out there, you should look at the information behind it regarding its accuracy. The first thing you look for is it FDA approved? Very important. The normal FDA process for approving tests to verify that they are accurate is a long process. And because of the rapid nature of the pandemic, early on the FDA had to issue a shorter route to approval called an emergency use authorization. And that basically put in the hands of the manufacturers of these tests the proof that it put the onus on them to prove that their tests were accurate. What was found out subsequently is that a lot of these tests really fall short in terms of accuracy. In fact, as recently as this morning, some of the tests that were previously authorized under the FDA's emergency use authorization are now being FDA is removing the authorization because of poor performance. This is especially an important issue with rapid tests, the ones that give you results in minutes, because there have been high rates of false negatives and false positives. This is especially important too for employers who are considering using testing as part of their return to work criteria, which is personally something I do not recommend. I don't think the science is there, or the level of knowledge on accuracy and usefulness of the test and an understanding of what a positive test means when you go. I'm talking mainly about antibody and antigen tests right now, not the swab test. We do know a lot about that. I think the science is not there to warrant that employers use those tests to make return to work decisions, because there are going to be problems with false positives, meaning that the test designates somebody as having had an infection in the past, I'm referring to the antibody test, when in fact they did not, therefore making them maybe more susceptible to certain exposures when everybody thinks that they're immune. And conversely, false negative tests, when somebody who really has an infection is not picked up by the test. So a lot of caution. There are a ton of tests out there. Do your homework, look up and see if it's FDA approved. Look at what the accuracy data is for that.
Hey, George, it's Bob. While you're on that topic and that theme, what about temperature screening? Because I get a ton of calls about this.
So, I've talked to some, well, actually, we even had a webinar here with one of our guest panelists from Shell Oil, Dr. Faiz Bojani, mentioned the experience at Shell where they had about 150,000 temperature checks, and they only had a handful of people who were considered to have a fever and returned home. I think, and some of the recommendations that you see out there, some of the guidelines include thermal screening with a thermometer, an individual thermometer. I think the jury's still out on that. I think from a standpoint of optics and giving some reassurance to people coming into a building or to an office or coming back to work, it's useful. But in terms of the actual ability to detect people with active infection, it's uncertain. I can tell you from our own internal data at some of the hospitals here in the medical center, temperature is not the most common finding in a person with an active COVID infection. That's a very important point. It's actually cough. It's followed by fever, but fever is less than 50%. Now, why is that important? Early on, you might remember when testing was scarce, and I'm talking about now February, we did not test people unless they had a fever. So they could be coughing, they could have shortness of breath, but if they did not have a fever, they were not testing. And we now know that we probably missed a whole bunch of cases by having that criteria. We're requiring temperature because we now know that many people do not have a temperature despite being actively infected.
Excellent, thank you very much. And I think that just illustrates Bob's initial comment about how this is a novel virus. We still don't know a lot about this virus. One of our IH colleagues from UT, typed in and put a comment that, we really don't even know the minimum infective dose of this virus, right? How many coughing particles do I need to inhale to catch the virus? We still don't know those details. So I think we're all learning as we go. Also, maybe Bob, you want to talk a little bit about system, HVAC system filtration rates and what that minimum we think might need to be?
Sure. We received a lot of calls about the recommended, the buzz term that you want to write down is ACH, air changes per hour, within what would be the suitable number. And as you might imagine, within various settings, they try to reduce the number of air changes per hour for energy conservation purposes. But we've just completed a study here looking at this exact issue with regard to outpatient clinics, newly minted Dr. Kristen King, for just to give you a rule of thumb number, and I'll get back to the air changes in a second here, but for clinics that would be doing airborne inducing activities, so in other words, you know, you're going to stick something down their throat or coughing or that kind of stuff, but that the recommended number would be 4 to 6 air changes per hour. But the really important point of this is it's outside air coming in, not just recirculating air within. And in fact, I think George will weigh in on this, that just the notion of just circulating the air within the facility without that outside influence could actually be more detrimental, because it could resuspend some of these aerosols that Janelle was describing. I'll pause there and say, George, you're on board with that one?
Right, yeah, the analogy I always use is ventilation is not the same thing as recirculation. What's the difference? Ventilation means you are replacing the air in a room with fresh air from the outside. So when we're talking about air exchanges that Bob was mentioning, 4 to 6 per hour, that means that every hour the air in a room is exchanged completely with air, fresh air, about 4 to 6 times. Recirculation, imagine that you take a room and you hermetically seal it off. You put duct tape everywhere, for example, and you close off the ducts and the cracks under the door and all that stuff. And you put a fan in the middle of the room and you turn it on. That air is moving, but it's not being replaced with fresh air. And in reality, so it's just recirculating. So if you have something like a viral particle, where if you cough normally, it falls down to the ground within 3 feet, usually 6 feet or less, certainly. Now you've got that fan going, and that virus that's headed all the way down to the ground now gets recirculated and resuspended. So the risk actually increases. So ventilation and recirculation are not the same thing.
And if I may, I can't point to data. It's not yet published, but I would, for those who are attending this event, particularly for people who are in leased space, I would encourage you to work with the people who own the space to find out this exact issue that George is describing, because the anecdotal evidence we're having here is that perhaps the air exchanges per hour, inclusive of outside air, because you have to condition that, right? If it's winter time, you got to heat it. If it's summertime, you got to cool it. So there's a cost factor there, but I would ask those pointed questions.
Great, thank you very much. I'll ask this question now, and I'll direct it to David Jimeno first, just because I know we chatted about it earlier off camera. Do we have any surveys of employees right now and their fears? What are employees most fearful about when returning to work or staying in their working environment?
Thanks, Tommy. So I want to link this to all these questions, because I think that what we think in terms of institutions and businesses, what we may think we know about the concerns of our workforce may not be accurate, right? So we need to be ready to ask, and we need to be ready then to act upon the answers we receive. And that's certain when also pointing to what Bob was saying early on. This is a novel virus, and therefore is a novel situation, and information flows and changes. And that's important in terms of messaging, because what we were saying at the beginning, maybe just it's about the fever, like George was saying, and now we know it's more than that. And the flowing of the information may also create a perceived sense in a large proportion of our workforce that it's unclear what's the message, and we don't know what's going on, and we are not being told everything, and so on and so forth. So there is a need really to be consistent, and the world as we know it sort of it changes, but also how that translates that into people returning to the workplaces, or not returning to work because most people have been working, but returning to the workplace. In terms of surveys, of large institutions like ours, the biggest need is really two big things. One is about flexibility in terms of being able to keep doing some of the job tasks from social distance. Typically, that will mean remote working from home, and that certainly will vary because we have a different type of jobs, clinicians and so on. But even then, linking to the questions on the therapies, you can do also telehealth. You can do virtual, face-to-face video communication, like we're doing, and you can do therapy. And so there are many different ways of dealing with that. So there is a perceived need for flexibility from the institution to still provide the ability for workers to, as much as possible, continue doing some of the work they do kind of electronically, And that links to the well-being part of this seminar, really, in terms of how that links to my needed for more social participation, being with friends, being with colleagues, and so on. So there is a balance there that we need to be able to measure in any workforce in terms of what does it mean working from home. Is it working from home 5 days a week, or if it's how we are going to regulate the workforce going back, and maybe in turns, maybe in teams, etc., etc. The biggest fear that we are receiving from our workforce is really the need to know if somebody gets sick. People have a fear, a biggest concern in terms of what if somebody gets sick, right? And that has other ramifications in terms of confidentiality and so on. But it's important in buildings, talking about exchanges, right? With our exchange may not be maybe unknown. People cannot open a window. We cannot ventilate like we can ventilate at home, and so on. So all those things are necessary. At the end of the day, is about creating a culture of trust where the message from the workplace that the employee receive is trustable, and that they don't perceive that we're just, I want to say, cheating them to go back to work just because there is a need for us for them to go back to work. If they can perform at a higher rate at their workplace at home, at the work environment at home, that is something that we should have into consideration. Anecdotally, just to finish this, in terms of comments that we receive, we receive a lot of people feeling less stress of now they are at home. Yes, some of them may have kids. Yes, some of them they need to cope with the separation between work and work life. But so a lot of our workforce may be driving 2 or 2.5 hours every day. They don't need to do that anymore. That reduces the level of stress. They have more time to do other things. And so there is a combination that not everything coming out of this situation is negative. There is a lot of positive. And I think the challenge for, let's say, the new business environment would be how you integrate the benefits of this situation, and realizing that you may not need to have everybody coming at the same time, and that is still you as an institution you can perform well, and that is a challenge that I think that every business is different. It's different in a restaurant, there is different in a hospital, there is different an academic institution, but that will be the challenge, how you integrate the positives that came out of this, and not only thinking about the negative.
Tommy, can I ask a question of CB that ties on to what David was just saying, and I know is of concern to many employers. So David mentioned that employees are worried about being exposed to other folks in their workplace, and they want to know, actually. So employers sometimes are facing a slippery slope, right? How much can they or should they tell other employees if there's a confirmed case versus the requirement really to preserve confidentiality? How do they, what advice do you give them from a legal standpoint?
Sure, yeah, because there's HIPAA protections, of course, with respect to health information and identity of individuals. So, and in most workplaces, you know, the communications we craft, we don't identify who has tested positive, but it's often not hard to figure out in workplaces when somebody's not there for 10 to 14 days or is, you know, suddenly gone. But nonetheless, we do want to respect people's privacy, or the identity is privacy. So the communications we work on crafting is, number one, just to figure out who has been within close proximity of that individual. And, you know, we follow what the CDC has been telling us about this, but okay, so identify who may have had contact within, you know, the social distancing space, who may have had maskless contact. At least put them on notice that they need to self-monitor, isolate as much or quarantine as much as they can, you know, pending, and if they identify any symptoms themselves, then they need to start really quarantining at home. So it's really about, again, identifying those who have had proximity, letting them know that they need to self-monitor, make sure that they're aware that they've had possible exposure, and then if they do start experiencing symptoms, to start the protocol for quarantining and contacting their doctor, finding out should they be tested, how to go about it, that sort of stuff.
That's a great question, and we certainly get that one a lot, and we had that one typed in as well. So kind of going further with that, what is the employer's legal obligation to disclose in general that we had a positive case in the office? You know, be on the lookout for your own symptoms. Do they have to tell the other employees that there was a positive case?
You know, you want to, because there's various laws that might come into play. There's OSHA obligations. There may be OSHA, Occupational Safety and Health Administration, particularly if you think it may spread in the workplace. So you have an obligation to investigate and determine if the spread has occurred in the workplace, or did the person who had COVID that's been diagnosed, did that person possibly get it in the workplace? And then you have reporting obligations under OSHA. So, and then you have workers' comp issues if it is spread in the workplace, and that there may be workers' compensation coverage for that. But getting back to your question, should you tell employees if they've been exposed? I think absolutely. I think you have, even if you don't have a legal obligation, you have a moral obligation. But I think you have a legal obligation, because you want to make sure that they are now aware that there's potential exposure, and you know, just to be careful, be monitoring, be aware, to protect themselves and to protect others.
CB, this is Bob. Just to attach to what you're saying, it seems to me that the other thing we need to do from a mental health perspective is to make sure once an employer does a notification that there was a confirmed case within their work environment, don't be surprised if you get a call or an email from the health department, if that kind of makes sense. Because I'm a little confused with your response there, that I'm not sure the companies, and I defer to my colleagues on this, I'm not sure the companies would do what I would refer to as contact investigation, right? But from a mental health perspective, to prep people. So, you know, conversely, you could have a situation where you have a confirmed case, and now that person has notified their supervisor, I'm not feeling well, I'm going to stay at home. But then so there's a notification obligation that you've described, but as part of that, in my opinion, as part of that notification obligation, some of you might be getting a call from the health department. And would you agree with that, or?
Yeah, I think where health departments are in fact doing contact tracing, then yes, certainly be expected. But you know, from the employer, from the legal perspective of it, and the CDC, again, it gives very good guidance on what to do if you've been exposed, or if you believe you've been exposed, and it tells employers and places of business that you should you should follow these steps. You should notify people who have had contact. But you know, extent you can determine, you know, maybe this person hasn't not been in the office for 10 days. So your last exposure would have been 10 days. So, you know, you then know, okay, I need to kind of be aware for the next 4 to 5 days, just based on the common notion or the prevailing wisdom, I guess, that there's a 14-day incubation period. But so giving people information like that, I think, is only helpful to let them know, you know, what they should be doing and how they should be reacting.
I want to go back to a point that are we finished with this line of questioning, or?
Sure, go ahead, Frank.
Yeah, I want to go to a point that David made, and if I heard him correctly, I understood that in the survey that was obtained, basically you found that the employee felt more comfortable at home or less stress at home. Was that correct?
Yes, some of them, yes.
Yes. And to me, what it seems to be is basically the level of control they have about managing, you know, how they deal with this pandemic. And one of the things that we can learn as employer is basically evaluate how we can give the worker, when they return to work, more control over their environment. You know, how they can sort of develop strategies or systems that are going to make them feel like they're more in control of what happens to them and what happens to others. I mean, as we know, and you know, David, you're the expert on this, if you have more control, you're going to be more satisfied with your work environment. So what are your thoughts, David, on that?
Well, as always, there is no straight answer, and there's going to be a mix, right? There's going to be a group of people that they want to go back to work, you know, yesterday, and they are totally mad about, you know, not being able to go back to the workplace. They're all working, just go back to the workplace. And then there is other people that may feel better, but it may also relate to what are the needs of the institution and figure it out a good balance of the work, non-work life, right? In the real sense of people, yes, you may have control, but it's about, at the end of the day, it's about performance and productivity. Can you be productive enough, you know, not coming, in our case, to the office? That is not true to all the workplaces, certainly, which, you know, particularly service, you know, industry. But in the office environment, can you be still productive of not going? And sometimes more productive. You know, a good chunk of our employees are reporting that they are working longer, you know, because sadly, as I said, they may have 2 or 3 hours, you know, of no commuting time, and they may be using that time to work, but as well to balance their work with the non-work activities, right, and which provide relief. So it's really about knowing what are your needs as an institution. You know, what is that you need from your workers, and knowing that we all know just being at the office doesn't mean you're being productive. The same way, you know, the same fear that the employer may have about, I don't see them, therefore I don't know what they're doing, and therefore they may not be working. It's the same thing when you're at the office. Doesn't change anything. It's a perceived sense from the employer, in general terms, that just being at the office makes you productive, where it may be the other way around. Again, there's typically this, just making easy, but 2 groups of people. The ones that are really truly more productive at the office because they have a work environment, which at home they don't. You know, that, you know, people are working on their kitchen, right, areas, and they are not happy about that. Versus the other ones that they can create an environment at home that make them productive enough. So that at the end of the day is about knowing what your workforce needs, and you as an institution, with this is a natural experiment, right? Have we detected that as an institution that our performance indicators are worse than before, and in things that, you know, not seeing, you know, clinical patients, which, you know, there has been an issue there, but in general office jobs, you know, are we seeing that people are producing less and being less happy, and so on and so forth? I mean, there is a stress. People are stressed about the possibility of the job, you know, being furloughed or losing it or whatever. There is not that people are happy, you know, at their homes. But there is still a way of managing that if you know what are your expectations and what are their expectations, and then you need to find a way of matching them. And to me, that's where it really matters, because in terms of the balance of your need as an institution, that's what we should be doing. And then it's about communication. Sorry, it's about this communication and providing a trustable, consistent messaging. Because one of the things is scary, I think Bob was mentioning, nobody tells you anything, and the next thing you get is a call from the Texas Department of Health telling you that, by the way, you are a possible contact. But nobody told me anything at my workplace, therefore my workplace is lying, therefore I don't trust my office to go back. And that's the circle that we get into unless as a business we're able to communicate as much as possible. And I think Clara was right there. People know if you get sick, if you get an accident, if, you know, there is a death in your family, people know this because we work in close environments and we work many hours together. So yes, HIPAA and so on, we shouldn't be close, but most people know what happened to other people in the workplace anyway. And if the business doesn't address that directly and you get it from an indirect source, that creates, I think, a communication distrust, and then it's difficult to recover every time there is something happening.
Excellent. Thank you very much for everybody's feedback. We're down to our last 10 minutes. So I'm going to kind of fire off some of these last remaining questions, and hopefully we can get through all of them. So if we can do some quick answers, if they're quick answers to give, that would be great. The website where you can go and download the presentation and view the full recorded webinar will be the Houston Area Safety Council's website. That's hasc.com. We're also going to email that out to everybody. So that takes care of that one. Frank, a question was, what was the name of that book that you recommended?
Yeah, it's called Rethinking Positive Thinking. Oops,
Rethinking Positive Thinking.
And the author is right there. Whoops, if I can do it. Well, the author is Gabriel Ottinger, Oettingem. Great book in how to deal with your negative thoughts.
Thank you very much. What are some resources, and maybe this is Monica can start this one off. What are some resources for employers to help assist their employees with their mental stress of getting back to work? Where are some websites they can go to? Are there some quick talking point kits they can look up to kind of help navigate this stressful time for their employees?
So, you know, we're probably a broad range of different employers on this call. Some employers will have an employee assistance program or a wellness program, even occupational health within their organization. And those are always good resources for their employees to access. It's also confidential resources. So instead of having to ask for financial resources or those kinds of things from your direct supervisor, this gives you a chance to go to a confidential resource within your organization. I am very impressed with the CDC resource list that is there on the website. WellCOA also has a number of resources for returning to the workplace. One of the things that we've learned, that I've learned over the years, both at UT Health and many other organizations, is telling employees once what resources are available is as effective as telling them what their insurance services are. So what's important at this point is recognizing that just because I learned something by reading it doesn't mean that everyone does that. So look at resources that can be posted in break rooms, sent out in emails, put on the front pages of your web pages, but understand who accesses what web pages. So you really have to dig deep into where do employees go to access their information. And their insurance carriers, we have Blue Cross Blue Shield. There's a wealth of information out there for mental health resources that are out there. The most critical piece is understanding your employee population and where they go for most of their information. And a lot of times it's WebMD or someplace else. So as Bob mentioned and David mentioned, have a very robust communication system within your organization.
Great.
There's also a great resource at University of California, Berkeley. They have a program there, and they have a website that is the Science of Greater Good. And it is wonderful. And it has great resources for employers and employees and the work environment. So you might want to go there. It's science-based, and they have very appropriate practical applications.
Excellent. Thank you very much. Question about facial coverings and employers requiring their employees to wear them. If there's no local or state mandate that they have to wear a mask, can an employer legally require their employees to wear a facial covering while at work?
Yes. Short answer is yes, they can. It's a private employer can impose its own rules. I mean, that would be the same with respect to COVID testing. A private employer can require COVID testing under EEOC guidance, and the same with face masks. The things that you have to consider are you may have employees that have medical conditions that limit or restrict their ability to wear a face mask, and you may have a duty to reasonably accommodate under the ADA, so you need to have dialogue with those individuals that are expressing medical reasons that they cannot, but the answer to the question is yes, you can require it.
Can we take that a step further, CB? And what can the employer require their customers or patrons to do the same?
Yes, a store, a restaurant, subject to eating, but yes, private businesses, businesses in general can require patrons and customers to wear face masks. They can prohibit them from entering if they're not wearing one.
Good to know. Christy?
CB, oh yeah, sorry, CB, as a follow-up to that, this might be obvious, I'm not sure. Then can a business owner do the opposite and require patrons to take off their face covering? I've been seeing some.
There's in fact, there's a lawsuit. Yeah, there's a lawsuit over that where in a restaurant in Texas where an employee wanted to wear it and the restaurant was saying no, we don't want our staff wearing them. She filed a lawsuit, and the initial hearing was successful. The court was ruling with her. So I think that answers your question. It's not a clear area of law, but it looks like courts will weigh in favor of the employee wanting to wear one or the patron wanting to wear one.
Great, thank you. There was a question about that the list in, so I put the slide back up. That is and correct me if I'm wrong, Bob, but that is where you go to find the contact time for that particular solution.
Yes, well, back up a little bit, and Janelle, I think, still on, but first of all, it's important that what you want to do is verify that the product that's being used to do disinfecting and cleaning within your organization is actually an EPA registered disinfectant, and list N you can go there and identify the product. And then Janelle, help me, because you hunted up this link. Does that include contact time on this link that you've installed?
Yeah, so that tool is really helpful because you can search all of these disinfectants by product name, yes, contact time, a bunch of different variables that you can search it by.
But if I may, and Janelle, help me before you leave that slide, sorry. And many times organizations will get, or perhaps you have a contract housekeeping group or whatever, but so they may get this material in a concentrated form and then mix it with water or whatever it is, to dilute it. And it's really important to make sure that they're mixing it to the right proportion, right? So let's say it's 1 gallon to 10 gallons or whatever it might be. because some of these firms might be cutting the corner and not exactly mixing it the way it's supposed to be. So that's one potential problem. And then the second potential problem, which I just observed firsthand, was this issue of contact time. That the notion of someone coming in and they're, let's say they spray down a table, that's wonderful that they're doing that, but the product that's supposed to, or a doorknob or something, but the product, the contact time is supposed to be 2 minutes. And so they're spraying and then immediately wiping off. And so you wonder, is that effective? So these are just kind of diagnostic questions. Janelle, are we in line with that, or? Janelle won't speak to me anymore, but anyhow. Yes,
I said yes in terms of her. Yes, Bob, you're right.
Okay, perfect.
You know, and there was a follow-up question. I think we answered it, but I'm going to ask it again. Can an employer require an employee to get tested prior to coming to work?
Yes.
Yes.
That's the short answer. The EEOC has specifically relaxed its prior guidances on pre-employment testing, and for this particular condition, for this particular virus, and an employer can do that.
Okay, excellent. I know we have reached our 1 o'clock mark, so if anybody needs to jump off, feel free to jump off. I'm going to try to shoot through I think we have about 4 questions remaining, so I'd rather just knock them out while we're recording the webinar, but if any of our panelists need to jump off, I totally understand. A question was asked about the turnaround time for the PCR nasal swab results to come back. You know, anecdotally, we test people a lot. We use the commercial labs, the big ones, and we've seen it from 2 days to 10 days. I think right now they're averaging about 4 days, 4 to 5 days. And I think it's just dependent on what lab you're using. If you're going into a hospital and they have their own lab set up, you may get it back quicker. But George, feel free to jump in on that if you need to.
So the commercial labs, and by commercial labs, we're talking about the very big operations nationally. You may have heard of LabCorp and Quest. They are averaging now, they've come down a little bit, around 4 point, not much days. Here at UT Health, we do our own tests in our own labs, and we have them often back within a few hours, and certainly by the next morning.
Yeah, exactly. Where in Houston would somebody recommend to go get the FDA approved serum antibody tests?
So again, you would have to go to the FDA and look at the list, but the commercial labs, again, they are using FDA approved tests. So any place like LabCorp that uses LabCorp or Quest or similar size large national labs are the most likely to have FDA approved antibody tests. I know that we are ordering them through our clinic through LabCorp, happens to be the one that we use, but it could be others.
So they can go to their primary care doctor if he uses Quest or LabCorp, which I'm sure he or she does. They can go just get that sample drawn there at their personal doctor, most likely.
Correct. And we do see a lot of patients in our clinic that are asking for specifically that.
Okay. Is there a place on the HVAC system itself that notes the air change number?
That's me. No. Typically what you have to do is there's a device that you put up around the diffuser and you measure that, but there's not an indicator that I'm aware of in these systems. But I would, so I guess my question would back to the person would be, who is it that runs your facility, and ask them what the ACH is, the air changes per hour, are in your facility, and the percent outside air, because some of these things can recirculate. But I would pause here for a second, and I forgot to mention this, and I apologize. We get a lot of calls about the issue of UV ultraviolet lighting systems. This particular virus appears to be quite susceptible to exposure to UV light. And so there's been a lot of marketing for lighting systems. Imagine a series of UV lights that you would put within your ventilation system. And then this would help reduce the circulation of any virus. But and I tell people that's fine, but a couple of points here. The amount of outside air is probably more important than the UV light. And number two, and I defer to my colleagues, please jump in on this one. These UV lighting systems look good, but they have to be maintained. So it's kind of like getting a puppy, right? You got to walk it and worm it and feed it, and all the stuff that goes along with getting a puppy. So you put these UV systems in, but if they get laden with dust, or the lights go out, or all these other things, then in effect you wasted your time. So I defer. David, would you agree with my assessment on UV lighting in the duct?
Yes, I agree.
Okay, he gives me the thumbs up.
All right.
I mean, if you have any other question, I would like to add a couple of things.
Sure.
One in terms of resources, we also have a lot of different resources listed on our website. That is the Southwest Center for Occupational and Mental Health. I think you have it here somewhere, but it's not as Southwest is swcoeh.org. And then the other thing in terms of mental health, and we'll be in a little bit to close this, but my fear is that we don't keep the communication lines open once this passes, because this will pass like everything else, that we are still providing enough attention to the workforce for them to be able to continue to report any issues they have. Not necessarily just the fear of COVID, but in general, because mental health is typically underreported and they diagnose everything, right? Everything is under. But this may have provided the opportunity for people to feel a little bit more free in terms of expressing their opinion towards this, what is happening and so on. And I think it's important to hear the workforce, and even in the event of the health of management, it is how managing all this information coming from large populations. But it still is important, I think, to figure out a way which may be different in different workplaces about how we do to hear our workforce for any issues, and what can we do about it.
So can I jump in on that too, David, because I think that having resources available to management to help them talk through these, their perceptions, their bias, their management decisions that they have to make, really is what organizations will evolve to hopefully implement during this time. The judgments around being, I'm anxious, should I be able to operate today? Or I'm worried about my family member. Families play such a critical role in the resilience of our own employees, and yet we think of them in isolation when they walk into our door. So I'd love this dialogue to continue to talk about how we can evolve as organizations.
Excellent. Thank you very much. For those that are at risk, higher risk, over 65, with some health factors maybe, what are some guidance measures for them returning back to work? Should they stay at home longer? Should there be some accommodations made at work? Any guidance for those higher risk individuals?
So CDC has some guidelines for high-risk workers, and it includes people over 65. It's going to depend on a lot of factors, Tommy. It depends on the nature of the business, whether you can do it from home. It depends on you yourself. Are you simply in that age group but otherwise healthy, or do you have underlying medical conditions that progressively increase your risk? So all of that has to be factored in. It's really got to be individualized a lot. The starting point is recognizing that there are some groups in society that are more vulnerable to the effects of a COVID infection. Not so much more vulnerable to the infection itself, but to the consequences, the severity of it. And so that's got to be discussed, I think, employer by employer.
Absolutely. Okay. I'm going to show this slide up here. There was a question about resources for mental health, and I think this was an excellent slide to show. I'm going to end it there. I think we've got a few more questions, but I think we could, as long as we keep going, more questions will come in. So what I'm going to do is stop it here, and I will email our panelists those remaining questions, and they will answer them back to me, and we're going to disseminate that information out to everybody. So again, I want to thank all of our guest panelists on today. I think we could have probably gone another hour and still kept the momentum going and the questions rolling. But we know that mental health is a big deal right now, and it's something that oftentimes, unfortunately, gets overlooked in our employees. So we thank everybody for their expertise today. We're going to again give everybody this information that was shared, as well as the resources and all of our PowerPoint slides. So thank you, everybody. I think we have another webinar coming on next week as well. Same time, same place. So we hope you join us.
Thank you.
Thank you.
Thanks to everybody.
Thank you.